I'm going to start with a little bit about my background, clinical observations in my practice, the scientific evidence to support the observations I've seen, talk a little bit about a no-low electromagnetic radiation protocol, and then summarize at the end. My background, my medical training was at the University of Oslo in Norway. I did my pediatric training at Columbia University School of Physicians and Surgeons. I'm a board-certified pediatrician, also a general practitioner, member of the American Academy of Pediatrics, participant in the Collaborative on Health and the Environment, and as Cindy mentioned, I've been in clinical practice for over 30 years. Okay. One more thing I wanted to mention is I started getting interested in how environmental factors can affect human health all the way back in the 80s, because I was living in Norway in April of 1986 when there was a nuclear meltdown in Chernobyl in Russia, and the prevailing winds were blowing towards Scandinavia, and the reindeer got radiation sickness because they feed off of lichen, and lichen feeds off the air, and so the radioactivity was very concentrated in the lichen. And that just sort of started my interest in radiation effects on wildlife, humans, etc. And at that time, I didn't know that non-ionizing radiation was a problem. Everybody understands that a meltdown at a nuclear power plant is a big problem. So I'm going to jump right into some of my cases. Can electromagnetic radiation affect sleep in children? So I want to give a few examples. A 4-year-old child came to me with both parents begging for help because they hadn't slept for 2 years, because their child hadn't slept for 2 years. And he had been in their bed, and every time they tried to go to sleep, he was all geared up. He wanted to play games, he wanted to eat, he wanted to talk, and they were completely exhausted. The day before they came to my office, they started a supplement, melatonin, and they thought that maybe that had helped a little bit. And this sort of jogged my memory that doesn't EMR, electromagnetic radiation, decrease the melatonin? And I just asked a few questions about the exposure in the home, and there was considerable exposure, so I suggested, why don't we just do a 2-week trial where you turn off the Wi-Fi for 24 hours a day for these 2 weeks, and you unplug all cordless phones, and you turn off the electricity to the bedroom if you can do it safely, meaning you have to have a flashlight. They did just the 2 first things, and within a week, this child was sleeping in his own bed, in his bedroom, had a wonderful night's sleep, and the parents for the first time in 2 years were also sleeping. And at that point, they took it to the umpteenth degree, and they figured out everything that could be an exposure in terms of EMF to try and make things even better for this child. Then there was a 9-year-old boy. The first boy was on the autism spectrum. He had pervasive developmental disorder. The second child, the 9-year-old, with sleep problems in the bedroom, he was neurotypical. He did not have developmental disabilities. His story was that he would sit on the sofa reading with mom, reading a bedtime story, and start getting drowsy, and they'd finish the story, they'd go into his bedroom, and he would all of a sudden get all geared up, couldn't fall asleep, and just be really wired. And so I asked a little bit about their EMF exposure, particularly in the bedroom, since he did seem drowsy in the living room. And mom reported that recently a smart meter had been installed at the head of his bed on the outside of the wall. So I suggested that they opt out and remove the smart meter and see if that made a difference. And it made a considerable difference, and he was able to fall asleep in his own bed. Then there was a 3-year-old child who had developmental disability, sleep problems, high-pitched screaming, very disturbed child. But mom wanted my help because she said, you know, it seems to me there must be something environmental going on, because when we go to my sister who lives in rural Oregon, he, within 24 hours, he has a normal circadian rhythm. He's able to sleep at night. He's awake during the day. But whereas in the Bay Area, he would be fatigued. And interestingly, when they would drive back from rural Oregon, back to the Bay Area, around Sacramento, he would start back with his high-pitched screaming. And it was very disturbing to them because where they were living, they were in an apartment. There was very limited possibilities for them to eliminate EMF where they were living. So they wanted to move, but it was a divorce situation, so they were unable to move too. So that child had poor prognosis. So is there any evidence of EMR effect on sleep? The Bioinitiative report of 2007 and 2012 states there is strong evidence from epidemiological studies that long-term exposure to extremely low-frequency magnetic fields is associated with a decrease in melatonin production. And then another study, Heising et al., sleep and the use of electronic devices in adolescents. It was the results from a large population-based study also concluded that melatonin is decreased, and that is the sleep hormone. So can EMR trigger or worsen aggressive behavior in children with autism? A 4-year-old with autism spectrum disorder and antisocial behavior. Actually, I'm going to do the 10-year-old first. The 10-year-old, the primary reason they came to see me was because of aggressive behavior, and he was so aggressive that he was breaking lamps in the home. Mom was quite petite. He would scratch her, bite her, and they were at their wits' end because they felt that it wasn't long unless they figured out a solution here, that they wouldn't be able to have them in their home anymore, and they really didn't want to give him up or have him institutionalized. He had autism, and he had never said a sentence in his life. And so after much coaxing, and they really didn't think that my suggestion, would help them, they did agree to try the 2-week clinical trial that I mentioned to you. And this child, within 3 days, said a full sentence. He said to his mother, "Mom, pass me the scissors." And her jaw dropped because she'd never heard her son say a full sentence before. And interestingly, his jaw also dropped because he was shocked that for the first time in his life, at age 10, anybody could understand him. His aggressive behaviors dissipated gradually over time, and his speech improved more and more. And after turning off the Wi-Fi, initially I usually say 12 hours at night, because I can't get a lot of the fathers on board if I say 24 hours. But once I say 12 hours and they see the improvement in their child, then the fathers are on board, and then they go wired rather than wireless. And then the 4-year-old, this is a child who came into my waiting room and started ripping down the blinds, turned over every chair, never made eye contact, just seemed really, really angry. And that was one of the first children that I did. I tried decreasing extremely low frequency, dirty electricity, by using filters in their home. I lent them a lot of filters. And the mom sent me an email after a week and said that her child had much more back and forth conversation. He was making good eye contact. His antisocial behavior was dissipating. He was receptive to the idea of a star chart for good behavior, and was helping her make the bed. The other thing she mentioned when she came into the office, because when I got her email, I thought this sounds too good to be true, but between the time that he'd been in my waiting room and disrupted my waiting room quite significantly, I had lowered the EMF in my waiting room. And when he came back, he was calm. He had a conversation with me. He looked at me. He looked much happier. And the mom also mentioned that now his bowel movements were normal. And I said, well, what do you mean his bowel movements were normal? I asked about digestion, and you said they were normal. There wasn't a problem there. And she said, yes, but he's my first child, and I didn't know. And she said, now I know that this is normal, so clearly also his digestion was being affected. And when your digestion is being affected, your immune system is being affected, because 70% of your immune system is around your digestive tract. And they found in studies that 40 to 80% of children on the autism spectrum do have digestive problems. So clearly this is affecting behavior, it's affecting physical health as well. So is there any evidence in the literature for effects on behavior? There is a physician, Dr. Christine Aschermann in Germany, who has written a very interesting letter with observations she's seen in her practice of personality changes caused by mobile telecommunications. What she's seeing is more and more inflexibility, lack of judgment, diminished self-criticism, this is in adults primarily, reduced effectiveness, irritability, inability to control emotions or impulses, insensitivity, intensification of character traits, and ethical values being lost. More evidence for effects on behavior. UCLA researchers studied 13,000 mothers and children. The conclusion was that prenatal exposure to cell phones was associated with a higher risk for behavioral problems and hyperactivity. At Yale University, researchers found that pregnant laboratory mice exposed to ordinary cell phone radiation produced hyperactive offspring with poorer memories. The U.S. Air Force Material Command says behavior may be the most sensitive biological component to RF microwave radiation. So can EMR trigger or worsen ability to learn in children with autism? A 6-year-old boy with an autism spectrum disorder, he tried a 2-month trial of the no-low EMR exposure. The parents got a phone call from the school asking for an extra IEP meeting because they wanted to discuss his progress. And so they were a little concerned when they walked in the room, and there were about 12 people in the room, the principal, vice principal, you know, everybody, you name it, they were there. And the parents were wondering, uh-oh, what's he done now? And the principal asked the parents, what have you done? What are you doing with your son? And they said, well, the only thing we've done is we're turning off the Wi-Fi at home, and we've unplugged all cordless phones. And they've done a few more things along those lines. And the principal said he'd never seen a child improve in cognition so fast in such a short period of time. And he had improved 2 grade levels in 2 months. So is there any evidence for EMR effects on learning? At the University of Kentucky, they've found wireless radiation can damage or even destroy brain cells. And there's a study on rats prenatally exposed to cell phone radiation. They developed impaired learning and showed damage to parts of the brain involved with memory. So is there any overlap between what electromagnetic radiation, that is non-ionizing radiation, can cause, and dysfunction, disease identified in children with autism? I decided to try and go systematically through the EMR literature and the autism literature and try and pull out, you know, where is there an overlap here? And what I found was that there was, these were the EMR resources I reviewed. The Bioinitiative report of 2012 has a whole chapter on autism. I think it's section 20. Cross Currents by Dr. Robert Becker. And the Naval Medical Research Institute has a summarized disease or dysfunction you can, from EMR. And they came to, I think it was something like over 180 different things that can go wrong. And I think it was over 2,000 studies that that was a meta-analysis. And then the autism resources I used were these here, where they each of these 3 books have summarized scientific studies. And there was a significant overlap. I'm going to skip. So what is electrohypersensitivity? It's a phenomenon where individuals experience adverse health effects while using or being in the vicinity of devices emanating electric, magnetic, or electromagnetic fields. All of the children that I have mentioned, they all exhibited electrohypersensitivity, but none of them had been diagnosed. I just have a few minutes left, so I'm going to skip a few. So here is incidence in California is about 3%, in Europe 10 to 15, and it's reasonable to suspect it's much, much higher in children because they are more sensitive. And so who gets electrohypersensitivity? Gro Harlem Brundtland, Prime Minister of Norway and head of the World Health Organization. She was one of the first ones to put EHS on the map. And these are other people I see in my office, executives of gas and electricity companies, doctors, teachers, accountants, speech pathologists. They're desperate to continue with their work. They love their work, and they can't find a building to work in anymore. So who's most at risk? Children are most at risk, mostly those with a vulnerable physiology. When should you suspect electrohypersensitivity? When there's a dramatic improvement in symptoms after a 2-week no-low EMR trial, or when symptoms change dramatically with a change in location. One mother came in and said her child was flapping and they was being evaluated for developmental disability, neurodevelopmental problem, but she said, when I take my child to my mother in rural Tennessee where there's no cell phone reception, this dissipates over a 1-month period, and when I come back to the Bay Area, it starts again. Another child, an 8-year-old child, he says he goes to school in San Francisco. Says he can't think straight when he's in the classroom, but out on the football field he can think fine. They thought he had a brain tumor or something like that. But it's the result of, it was a very high-end school with smart boards and you name it. So you can read more about my protocol in more detail if you look online. It's called Calming Behavior in Children with Autism or ADHD. It's very important to quantify symptoms before and after, and to document the symptoms so you can stay motivated. I have a booklet outside. You can feel free to pick it up. What you need to know about wireless radiation in your baby, how to protect the fetus. This is spearheaded by Hugh Taylor, chair of the Department of Obstetrics and Gynecology at Yale. And I agree with Dr. Martha Herbert on Wi-Fi in schools. Wi-Fi should not be used in the classrooms for children with special needs, and neurotypical children should have the opportunity to opt out. They can learn just as much and more if they have a wired environment. Here are resources for teachers. Here are some resources for doctors that want to learn more about this. The guidelines of the Austrian Medical Association with the ICD-10 code, exposure to radiation. Citizens for Safe Technology. There's a doctor's information package there. And the Bioinitiative report is very large, but the summary for the public is excellent. I won't go into that. The American Academy of Pediatrics says current FCC standards do not account for the unique vulnerability and use patterns specific to pregnant women and children. It is essential that any new standards for cell phones and other wireless devices be based on protecting the youngest and most vulnerable population to ensure they are safeguarded throughout their lifetimes. And a neuroscientist at Karolinska Institute in Sweden, I thought this was wonderful. He said, never in the history of mankind has such a large body of good knowledge been utterly ignored for years by those in positions to change policy. We have very serious ethical questions we need to answer. Is my need to talk to anyone, anywhere more important than a child's need to talk at all in a lifetime? If we do nothing, can we be accused of child abuse? Child abuse is hurting a child physically or mentally. What are we doing when we allow children to not be able to sleep, not be able to learn, not be able to have normal memories, not be able to have good behavior? So the take-home message is serious illness in children can improve, sometimes dramatically, in a short period of time by following a no-low electromagnetic radiation protocol. Good science alone is never enough to force sensible public policy. Only citizens can do that. By Samuel Miller. Thank you very much for listening.